Welcome to You and Your Pets. I'm Jim Horton, and I'm here with our resident expert, Dr. Ernest Rogers of the Maplewood Animal Hospital. And we deal with a wide range of concerns and problems and issues related to pets on this program. Tonight we're going to be concentrating on preventative medicine from the head to the tail of your pet cat or pet dog. And I'd like to start, if possible, with the eyes. Maybe we start with the eyes and
That's the front end, one of the front end parts.
one of the front end parts.
So the eyes are important, as we see, and I think in humans it's probably one of the more readily identifiable parts of the animal, that because we use our eyes so much, to see a dog's eyes, it's important, especially in preventative health, to really look at your dog's eyes. So we talk about how sun and UV light can cause problems for eyes in humans, and people should wear sunglasses. Well, I don't recommend dogs and cats wear sunglasses. I think realistically we have to look into our dog's eyes. Changes in the color of the iris, changes in the white of the eye, in other words, if it gets bloodshot or yellow, eyes that don't focus properly, dogs that walk into things. Those are all symptoms that should make you aware that there's something going on with your dog, and maybe it should go to the veterinarian. Certainly an eye that is injured in a trauma and pops out, that's an immediate emergency. Eyes that the dog seems to be scratching at is another sign that they should be seen by your veterinarian. So in terms of preventative health, the eyes are maybe the soul to the window to the soul in the dog, but those type of scenes or those type of symptoms or signs should alert the owner to take them to the veterinarian for further workup.
Now, what are some of the diseases that an owner might be able to determine relation to the eyes, like pink eye or something like that? What should they be looking for and that kind of thing?
Right. Well, certainly pink eye is something that we see in children, and it's fairly common to most parents. A discharge, usually a green, red, or brown discharge from the eye, and a very, very irritated eye. When you pull the lid down, the pink part of the eye now is almost an angry red. There might be discharge from the eye that is also liquid, and the dogs would probably be scratching at its eye, rubbing it on the floor, on the ground. So that would be pink eye. Another disease that we see that owners can get signs of is often glaucoma. And again, the dog would be rubbing at the eye and pushing its eye along the ground. It might be favoring the eye in that it squints, and all those are signs that there's something going on with the eye. Glaucoma is an increase in pressure, and so sometimes if it's not caught early enough, the actual one eye would actually look bigger than the other, and the pupil or the center black of the eye would be bigger in one eye than the other. That can be glaucoma, it could be a neurological disease, it could be a trauma, it could be a tumor. So it's important that if you see changes in the eyes, you at the very least call your veterinarian, and it would probably be best if you brought the patient in, whether it's a dog or a cat.
Okay. What about the face and lips?
Well, we do have, as we're starting at the head, the face and lips are all telltale things that we can look at. Certainly the face, we sometimes see facial edema or facial swelling after a vaccine. It's not something to be seriously concerned about, but it is something that you should bring to the attention of your veterinarian if your dog does have that kind of reaction. So the dog would sort of look like a puff dog or a puff cat. Other things that can happen, I often find in my practice that any animal that is eating out of an improper bowl, sometimes these bowls are from Mexico and not properly glazed, and that leads to lead poisoning. Sometimes the bowls are plastic, and the animal can have a dermatitis or an irritation of the skin with crusty open pustules or crusty open sores, and the lips will be swollen. And that's all due to a dermatitis or an allergic reaction to whatever they're eating out of. Certainly the face and, again, scratching at the face, pawing at the face are all signs that we might have external parasites, something like fleas, and that can be an effect that we see in the face.
Okay. Let's turn to the teeth and the oral cavity now.
Well, the teeth are unfortunately one of the big areas that pet owners overlook, and they don't feel it's as important. But realize that we as humans, we brush our teeth twice a day, we floss twice a week, and we see our dentist for a cleaning twice a year. Our pets don't have that option. Often people feel that using certain foods, certain chew bones, certain chew toys will help, and though they may help a little bit, it doesn't replace brushing the teeth or a professional cleaning where we knock the dog out. And if you remember, Dr. Anthony was on our program, the veterinary dentist, and as he said, there's no way to do a dentistry unless you knock the dog out. There's no other way to do it properly. You can make them look cleaner, but you aren't getting under the gum. It's just too painful. The dog won't allow you. So the signs that the owner should be looking for is crusts, brown crusts on the teeth, an angry-looking gum. It's almost red, and there could be a red line, and it's very bumpy, very thickened right against the tooth. Chewing on only one side, failing to chew, having food drop out of the mouth. All those are signs that there might be a problem with either the tongue, the teeth, or the roof of the mouth. And so all those are signs that should trigger a veterinary visit.
Okay, that also brings up the chewing and swallowing generally.
Right. Swallowing is, and in my clinic, I have many people that come in, and the first thing I do is give their cat or dog a treat. And people think, oh, you're just trying to be friendly with the cat or dog. Well, yes, that's true too. But the issue is that if I don't give them a treat, I don't know if they can chew and swallow. They might be able to chew and have trouble swallowing. That can be signs of many different diseases and many different issues with the nervous system innervating the tongue and the throat. So if they can't chew and swallow, I know there's something I have to look for more than just teeth. Chewing and swallowing is a very complicated movement, both in humans and in animals, both dogs and cats. And so when I open up a mouth, I'm looking at the roof of the mouth for anything that might stop. I have found bones wedged between teeth, which will stop a dog from being able to properly swallow. Mm-hmm. In cats, I've seen strings tied around the tongue that, especially if the cat's vomiting, you'll find a string tied around the tongue because the cat has found a string, played with it, swallowed it. Half went down around one side of the tongue, the other half went down the other side of the tongue, and now it's cut into the tongue. So that can stop swallowing and actually can block the cat, and I've had cats die because of that. So chewing and swallowing, though a complicated movement, owners can watch and see, does my dog chew only on one side where it was chewing on both sides? Does my dog have a problem swallowing? Can he not swallow? Is there excessive drooling from either a cat or a dog? All those are signs. It can be a sign that there's a tumor in the mouth or there's a fractured tooth, but it could also be a sign that the dog or cat can't swallow. And the big disease we think of when we think of that, and this is not an issue for 99% of the cases, is obviously rabies, where if you see a wild animal that can't swallow out in the real world, you should be considering rabies if this animal is running around. So even though we treat dogs and cats, and it's very rare in dogs and cats to have rabies, a wild animal that can't swallow and is drooling, that could potentially be rabies. And that's the time to call not your veterinarian, but maybe the animal control officer.
Okay. So let's move on to the ears and the flaps.
Okay. The ears and flaps are one of the big areas that we see a lot of in veterinary medicine. The ears and the irritation of the ears, either due to allergies or due to yeast called malassezia, or due to a bacterial infection in dogs, and it can occasionally happen in cats. One of the big problems we see, dogs are shaking their head. Sometimes they shake their head so hard that the flap of the ear, the actual flap that either hangs down or stands up, can actually have a pillow form in it. And I have lots of people bring their dog in for vaccines and say, my dog has this pillow in his ear. Well, that's a bloody swelling, or what we call a hematoma. Quite frankly, that's something that indicates that there's a problem in the ear. In dogs and cats, we can see ticks in the ears. In cats in particular, we often see a mite that goes in the ear. It looks like a little crab, and it's not quite microscopic, but small enough that you have to use a microscope to see it. And it crawls around in the ears, causes the ear to be very, very itchy, and you see a crusty, brown-like discharge from the ear, but the cats are just going crazy. Usually behind their ears there are scratches and claw marks because they're trying to get into their ear, and of course they don't have thumbs and they don't know how to use Q-tips, so it's very unlikely they're going to be able to get into their ears.
Okay. Let's move on to the oral cavity, the esophagus, the stomach, the small intestines, large intestines,
Right.
the whole gastrointestinal
The whole gastrointestinal system. We see a number of things that go on in the gastrointestinal system. One of the more common things that we see is vomiting and diarrhea. Often a dog or a cat will get into something that it shouldn't, garbage, old food left on the street, and they'll eat it, and the first thing the stomach does is, whoops, we shouldn't have eaten that, and they vomit it up. Certainly the government, the gastrointestinal tract will then try and get this through as fast as it possibly can. So it'll go from the stomach to the small intestine to the large intestine and out. And often it goes through so quickly that the liquid is not absorbed and it comes out as diarrhea. Diarrhea can also be bloody and it can be mucousy, which are signs of other situations that are going on in the intestinal tract. The intestinal tract itself is one big long tube that has organs attached to it, and those organs include the liver and the pancreas. And so those areas right then and there lead us, when we see an animal with issues, especially if we think it's the gastrointestinal tract, it leads us to a series of testing that would be done to examine what part of the gastrointestinal tract is being affected.
Okay, and liver disease?
Liver, as part of the gastrointestinal tract, is one of the biggest organs in the body that actually allows detoxification of anything the animal eats or gets into. So the liver signs that we might see in a dog or a cat: yellowing of the skin, yellowing of the white of the eye. We often see that. Even the inside of the mouth might look yellow or orange. Certainly vomiting and diarrhea can go along with that. And then the pancreas, another organ that makes digestive enzymes, that can also have problems, and we can get pancreatitis. Pancreatitis is one of those diseases that the pancreas that makes the digestive enzymes is actually digesting itself. So in a dog, it's very painful. We don't see the same painful signs in a cat. But quite frankly, if an animal is vomiting and diarrhea, not eating, and appetence, we often think of pancreatitis. So that's something that an owner, again, if a dog's not eating and it's vomiting, particularly if they're in a dog, if there's pain, or if in a cat they seem to have a mushy stomach rather than a normal stomach, which is difficult for an owner to know unless they followed up. These things are things that we see with pancreatitis. Certainly we can't differentiate necessarily pancreatitis from liver disease, from gastrointestinal disease, bacterial overgrowth in the intestines without certain tests. So I want the viewers to understand that whatever we do, we have to do based on blood tests or fecal tests or some other tests, and that's what makes this also complicated. Dr. Google isn't going to help you in this situation.
Okay. Well, we're going to have to take a break, and when we're done with the break, I'd like to go through several more systems of the dog and the cat.
Move towards the butt.
Move towards the tail, yes. This is You and Your Pets. I'm Jim Horton. We'll be right back.
Television is a powerful and influential medium that allows different groups the opportunity to produce programming that directly affects their own communities. Public, educational, and government access channels ensure that all people, regardless of race, age, gender, disability, religion, or economic status, have access to local government information and the use of a public communication forum. Make sure everyone has a voice. Support your local PEG channels.
Welcome back to You and Your Pets. I'm Jim Horton, and I'm here with our resident expert, Dr. Ernest Rogers of the Maplewood Animal Hospital. And we've been talking about preventative care of your pets. And I'd like to turn now, if we would please, to the respiratory system and the things that pet owners should be aware of in that.
Certainly. And in the respiratory system, let me just define it. The respiratory system goes from the tip of the nose, in through the nose, through the sinuses, down the windpipe or the trachea, right down into the lungs, and that includes all of the respiratory system. In any part of that system, we can have problems. Those problems can be anything from an infection, and in some cats, we get something called rhinotracheitis, especially in young cats, especially if they're on the street, where they have a severe nasal discharge and eye discharge. And even though the eyes and the eyes and nose are linked, the discharges are different. But that is one of the problems. So when you see a discharge from the nose, even a discharge from the eyes in some cases, that indicates that there might be something going on with the nose and that part of the respiratory system. If you go back further, there's the in the skull there are sinuses, and those sinuses can also become infected, and many people have suffered from that. So we want to make sure that we look at the discharge, we culture or find out what kind of bacteria is in the discharge, and then we treat with the appropriate antibiotics as best we can. So the head, the nose, and the sinuses are all part of the respiratory system. From there, when you're breathing, it goes down the trachea, and we know that there are certain diseases that we see in dogs that particularly Bordetella bronchioseptica, which is a kennel cough, or canine influenza virus, both of which can affect the trachea and the lungs. So if we have an irritated trachea or a problem in the pharynx, larynx, which is between the sinuses and the trachea, excuse me, we have an irritation and we often get a cough. And so a cough is one of the signs that the respiratory system can be involved in issues that from preventative health care may well be worth at least talking to your veterinarian to find out what he thinks, excuse me, and whether or not it's necessary for you to come in. Postnasal drip is what I'm having. Postnasal drip can also cause a problem in a dog, and you might actually see them coughing and spitting stuff up. So that we call a productive cough. And when that's coming from the lungs, we tend to think of pneumonia or pneumonitis. And then going further down, the trachea can be irritated. Of course, the lungs themselves can be infected. Lungs can be infected with many things, including parasites. Many people don't realize that there are lungworms. We see them more often in cats than dogs, but we see them in both. Certainly, many times the parasites can affect the lungs. So we want to be very clear that if a dog is coughing up something, and it's not that it just does it once or twice, but if this is a continuous thing over a couple of days, especially if it's green or bloody, we want to have that dog come in and see us. Often the kind of things we think about, there can be tumors in the lungs, there can be tumors in the trachea, there can be tumors in the sinuses and in the roof of the mouth. So these are the kind of things in older dogs we want to think about. Younger dogs, when they're coughing, we tend to think of pneumonia or kennel cough or distemper. So there are many other diseases, of course, but that's up to your veterinarian to diagnose. And he'll use various modalities to diagnose these things, including x-rays.
Okay. So let's turn to the heart and the vascular system.
Great. And as you know, the heart is not, all these systems that we're talking about them as separate systems, excuse me, are not separate systems. They're all interaction. So when you have a problem with the nose and you're coughing, that's a cough that you see, and it has to be differentiated from the cough you might get with the heart and the vascular system. Particularly heartworms in the heart can cause coughing. Congestive heart failure, which we'll be talking about with our next program, can cause coughing. Enlargement of the heart can cause coughing. Poor circulation on one side of the heart, the part that goes to the lungs, can cause coughing. So one of the big signs that we see with heart problems is coughing. Some of the other signs we see, and one of the major signs, and this is something that owners should be aware of, a decrease in exercise. And it's very, very subtle. Often it happens over weeks to months. So the owner might actually see their dog out playing with the ball, and then you throw the ball and the dog gets it once and doesn't want to get it again. The dog doesn't run up the stairs anymore. The dog doesn't want to go for a jog with you anymore. They can only go so far on a walk and then they stop. All these are signs that indicate the heart might not be pumping properly. Blue tinge to the tongue, to the inside of the ears, that might be an indication that the dog is not having a heart. The heart isn't properly infusing the blood through the rest of the body. So realistically, it's hard to differentiate these things without a stethoscope, without x-rays, without blood work. And this is why I really want to bring these preventative health measures, signs and symptoms to the owner's view, so the owner can look at it and say, hey, don't know what it is, let me take it to my veterinarian.
Okay. So let's turn to the kidneys and the urinary system.
As you know, There can be problems with the kidneys and the urinary system. I think your little dog has problems with crystals.
Yes, he
and
does.
And we have her on a special diet. I think the issue here is the kidneys and urinary system, again, are not devoid of all the rest of the systems. So not eating properly can result in crystals. Eating the wrong things can also result in fat being deposited in the abdomen that can then affect the kidneys. So one of the things we look for is a proper diet. But if we see blood in the urine, and let me step back and make a comment about the system itself. The system itself is the kidneys, the ureters, which are the tubes from the kidneys to the bladder, the bladder itself, and then the urethra, which is the tube out. And in a male, we all know it goes through a penis, and in a female, it goes through a vagina. Females tend to have more bladder infections than males, but males can have bladder infections. And in those cases, some of the signs that the owner should be looking for is blood in the urine, very dark urine, or very crystal clear urine. Not that this is always a sign of a problem, but it is a sign that should alert the owner that this could potentially be an early sign of a disease. Those diseases can be cystitis or a bladder infection, a kidney infection, crystals in the kidney, crystals in the bladder, or it could just be a sign of urethritis, an infection or inflammation of the tube that goes out.
Okay. So the endocrine organs.
Endocrine organs, and of course the endocrine organs affect all kinds of things. We have the thyroid, for instance, and the thyroid disease is thyroid is a little gland that situates just in the thoracic inlet, or right where the neck meets the chest. It's a little quarter-sized gland in a medium-sized dog. And what we see that's the body metabolism organ. It's like the thermostat of the body. So typically what we see low thyroid or hypothyroid in a dog. And some of the symptoms of that is lethargy, putting on weight, heat seeking, particularly in the winter they like to sit by radiators. Those and putting on weight without eating very much is a very, very normal sign that we see, and often the owners come in because they're overweight. Of course, in cats, it's the opposite. We rarely see hypothyroid, but we do see high thyroid, which is hyperthyroid. And hyperthyroid, the cat eats and eats and eats, but still losing weight. Often the cat has high blood pressure, which the owner can't tell, but when a cat is eating ravenously and still losing weight and seems to be hyperactive, that's a sign that maybe you should bring it into the veterinarian. He can take a blood pressure, and we can determine whether or not, with a blood test, whether or not we have high blood pressure in this cat. High blood pressure then goes on, if it's left long enough, to cause problems with the kidneys, with the liver, with the brain, and the heart. So we want to make sure that these signs of ravenous eating, losing weight, hyperactivity to a certain extent, and in cats are addressed.
Okay. Let's turn to the adrenal gland.
Adrenal glands, again, there are two forms. Adrenal glands put out hormones. We have hypoadrenals, which is also called Addison's disease, and we see lethargy and we see increased drinking, vomiting, and diarrhea. We also, and this can occur both in dogs and cats. And then we have hyperadrenal corticism, or hyperadrenals. That's high output. And those type of things tend to cause a sluggish belly. You tend to see a pot belly appearance, thin skin, vomiting again, and increased drinking and urinating. So you need a blood test to tell those two apart.
Okay. So let's turn to the brain and spinal cord.
Brain and spinal cord, like us, is very susceptible to disease, but more so injury. It's not that we don't have brain diseases in dogs. Of course we do. And sometimes we can have strokes, and we see dogs that have strokes. But typically, an animal injured in a severe car crash where the dog's in the car and hits something, or where a car hits the dog, or where the dog falls, often we can have problems with the discs in the back, particularly the discs related to between the pelvis and the neck. We can see disc degeneration disease. And particularly in certain breeds, we know that it's higher in dachshunds. We can see degeneration of the spinal cord, and one of the things in the spinal cord is we see in German Shepherds, which is the degeneration of the spinal cord, and we start seeing one of the early signs of that is they can't walk properly. All of a sudden they're throwing their legs out and they're having trouble standing up. They decrease their exercise again. In dachshunds or any dog that has a disc problem, we might see an acute onset where they're dragging their legs. That is absolutely an emergency and should go to the emergency clinic, if not to your veterinarian, immediately. Other problems, dogs get hit in the head. We sometimes see that they have issues with blindness, particularly if they're hit on the back of the head. We can also see issues with hearing, where the nerves from the brain to the ear can be affected by both parasites, infection, inner ear infections, and we can see, because the auditory nerve, or the nerve for hearing, runs right beside the vestibular nerve, or the nerve for balance, we can see animals circling, we can see animals falling down, we can see animals that have eyes that go crazy. If you notice the eyes are going crazy back and forth, that's one of the signs that there is probably an issue with some part of the brain.
Okay. Let's turn to the skin now.
Okay, good place to get to the end of this. The skin itself is one of the biggest organs in the body. The things we worry about are lumps and bumps, particularly if they're open, if they're bleeding, if they appear suddenly, if they're attached to below the skin so that when you grab them you can't get your fingers underneath them. If the dog seems to be bothered by them, that's a real issue. So lumps and bumps, particularly on the legs, if they're attached to the skin and they're movable and they're small, see your veterinarian, have them decide whether or not it's a malignancy or if it's just one of the normal aging processes. On the other hand, if it is a significant bump or lump, we might have to take it off to diagnose whether or not it's cancer. Finally, the big thing about the skin, and everyone sees this, are parasites. Things like fleas, ticks, mosquitoes. And any kind of irritation, spider bites, any kind of irritation can result in an allergic reaction, which we have to then treat with antibiotics and some allergy medicines. So we have quite a ways to go with the skin and looking at it, and that's one of the big organs that's on the outside, and you can see things, loss of hair, open scales, sores are all things that you want to bring to the attention of a health professional, a veterinarian, when you notice them. And if they're nothing, they're nothing.
Okay. So basically, in summary, a pet owner needs to pay very close attention to his animal at all times.
I think knowing the normal, watching your animal, and spending time with your animal, feeling them, looking at them, is the best way to get a feel for the normal.
Okay, we've run out of time, but thank you very much. This has been You and Your Pets with Dr. Ernest Rogers. I'm Jim Horton.